If you are over 60, the absolute worst thing you can do every morning is throat clearing or chugging boiling water with lemon. Top ear, nose, and throat specialists are now warning that this single reflexive habit is silently accelerating a destructive vocal cord deterioration faster than almost anything else you do. Stop treating that persistent phlegm like a minor annoyance or a simple sign of getting older. It is not just extra saliva, and it is certainly not a normal part of the aging process. What you are actually doing when you aggressively hawk and clear your throat is tearing the delicate, protective mucosal lining of your upper airway. This creates microscopic lacerations that invite chronic inflammation, setting off a dangerous chain reaction that can permanently alter your ability to swallow safely. You have likely tried every generic remedy on the market, from expensive over-the-counter expectorants to drinking gallons of warm herbal tea, only to find that the thick, sticky sensation returns just 20 minutes later. That is because the root cause of this relentless throat clearing is completely misunderstood by mainstream medicine and standard online blogs. Your body is not actually producing too much mucus because of a random cold or standard seasonal allergies. Instead, your upper esophagus is trapped in a critical state of neurological confusion, causing your throat to constantly feel restricted, tight, and suffocated. By continuing to swallow blindly or cough aggressively, you are forcing your body to defend itself by producing even thicker layers of mucus, creating an inescapable, vicious cycle that compromises your respiratory comfort day after day. Most seniors assume they are protecting their body and simply managing a mild irritant, but behind the scenes, a destructive process called tissue starvation is cutting off essential cellular hydration to your upper airway tissues. Once you hit 55, your throat muscles naturally begin to lose their elasticity, meaning they can no longer clear natural secretions effectively on their own. When you ignore this underlying structural decline, that stagnant, thick pool of mucus becomes a breeding ground for dangerous pathogens, leading directly to chronic aspiration, where fluids enter your lungs completely undetected. This silent aspiration is the leading hidden driver of sudden, severe respiratory infections that completely rob older adults of their physical vitality and force thousands into long-term care facilities every single year. The terrifying reality is that this constant sensation of a lump in your throat is actually a neurological distress signal telling you that your swallowing reflex is failing. As the mucosal layer hardens and thickens over time, it begins to permanently distort the delicate nerve pathways that coordinate your airway protection. This means every single time you eat a meal, drink a glass of water, or try to sleep flat on your back, you are at a massively elevated risk of choking or experiencing sudden nocturnal suffocating episodes that trigger intense panic. This is not a condition that stabilizes on its own. If left untreated, it leads to a permanent loss of dietary freedom, severe voice loss, and an inability to speak to your family without agonizing pain, destroying your confidence and independence entirely. Fortunately, reversing this frightening trajectory does not require a pharmacy full of prescription drugs, invasive throat surgeries, or spending hours practicing grueling vocal therapy exercises at a clinic. In exactly 60 seconds, I am going to show you the incredibly simple 3-step physical activation method that clears this stuck fluid overnight. But first, you absolutely must understand exactly why mainstream medical solutions are actively making your symptoms worse. If you continue to rely on standard nasal sprays, generic throat lozenges, or heavy antacids, you are merely masking a profound physiological malfunction while allowing the underlying cellular damage to advance completely unchecked, ensuring you stay completely dependent on medication for the rest of your life. When you use standard treatments like over-the-counter antihistamines or aggressive nasal flushes, you are actually placing immense chemical stress on your delicate pharyngeal veins, completely choking out essential blood flow to the throat tissue. Think of it exactly like bending a high-pressure garden hose. The harder you try to force the water through, the less fluid actually reaches the dry, inflamed areas where it is most desperately needed to dissolve the sticky phlegm. These commercial products strip away your body's natural moisture, tricking your nervous system into believing your throat is under a severe dry attack. In response, your defense systems kick into overdrive, pumping out massive waves of an even thicker glue-like mucus that cements itself to your airway walls and refuses to budge. This new medical breakthrough works by completely bypassing that counterproductive friction, instantly triggering a rapid tissue relaxation response using nothing but your own natural anatomy while sitting completely still. Instead of trying to dry out the throat, this neurological method targets the glossopharyngeal nerve, which acts as the main master switch for your entire upper digestive tract. By activating this specific nerve pathway, we can instantly command your throat muscles to open up, dilate your local blood vessels, and flood the area with fresh, oxygenated blood. This immediately thins out the stubborn, hardened mucus deposits from the inside out, allowing your body to naturally and effortlessly clear the airway without a single cough or painful throat-clearing motion. Here is exactly how to execute this breakthrough method right now to clear your throat permanently. First, sit perfectly upright in any sturdy chair with both of your feet planted flat on the floor, keeping your spine completely straight and your shoulders dropped and fully relaxed. Do not lean back against the chair. You need your neck muscles to be entirely free from external pressure so the deep nerve pathways can align properly. Close your mouth completely, place the tip of your tongue firmly against the roof of your mouth, right behind your front teeth, and breathe slowly through your nose for 3 deep cycles. This specific posture instantly reduces systemic tension and prepares your vagus nerve to receive the therapeutic neurological stimulation required to release the trapped phlegm. Next, slowly elevate your chin toward the ceiling at a 30-degree angle while simultaneously applying a very slight, steady downward pressure on your collarbones using the palms of both hands. This deliberate countertension creates a safe, highly targeted stretch across the anterior neck muscles, which instantly wakes up dormant nerve pathways responsible for your swallowing reflex. While maintaining this gentle stretch, execute a deep, dry swallow without moving your head or letting your tongue drop from the roof of your mouth. You will feel a distinct pulling sensation deep within your throat. This is the exact moment the restricted muscle tissues are forced to dilate, opening up the constricted airway and breaking the sticky bond of the mucus. Hold this exact contracted position for 5 full seconds. Release your hands smoothly, lower your chin back to a neutral position, and repeat this sequence exactly 10 times in a row. You must perform this routine before you allow your feet to touch the floor tomorrow morning, as mucus naturally pools heavily in your throat while you sleep. By executing this method immediately upon waking, you intercept the morning phlegm buildup before it has a chance to harden and ruin your vocal cords for the rest of the day. Consistency is absolutely paramount here. Doing this daily rebuilds the baseline strength of your swallowing mechanism, ensuring your throat remains completely clear, open, and fully functional without any external help. Commit to performing this technique tonight before your head hits the pillow, and you will notice a massive immediate difference in how clear your throat feels before you even brew your morning coffee tomorrow. Do not let your peers continue to struggle with chronic coughing or accept a declining quality of life as an inevitable part of getting older when the solution is this simple. Send this video right now to someone you deeply love who needs to protect their voice, maintain their daily comfort, and preserve their physical independence for years to come. By sharing this precise medical insight, you are actively helping them break free from a dangerous, silent cycle of airway decline and reclaim control over their health today.